Are we ready to get started? Okay. So we'll give just a couple moments for the folks in attendance to take their seat because you are in for a treat. All right. I'm Patrick Newbold. I'm the Director of Information, the Office of Information Technology here, and also the Chief Information Officer for CMS. And I'm so happy to be here. Thank you all for those in attendance. Good to see your faces, and we've had several good conversations today. But I also am aware we have about 1,500 people online joining us from virtual land, and we want to thank you as well for joining us in these critical conversations. So today I have the pleasure to moderate the third and final panel today, and we're going to talk about, you guessed it, AI, since we haven't talked about that today. About a month ago, I was actually at a basketball game watching the Washington Wizards, and I was sitting next to a rural provider out of Ohio, a clinician. And I don't know quite how we start talking about healthcare and CMS. Maybe because the Wizards were down 20 points and we lost interest. But she shared with me an experience she had recently. And when she was reaching out to one of our support centers virtually to get, she had some questions about the coverage. And so when she was asking those questions, she was able to input that in online, and we had just rolled out some AI assistant. And she received her questions accurate and timely within minutes, and traditionally she told me that it took weeks to get that information. Now what's unique about this, if you know the rural clinicians, you're not just a clinician, you're kind of a jack of all trades, you're doing a lot of things. And she shared with me that, you know, she don't have time during the day. Her attention must focus on the patients. And so when she was seeking the answers to this, and usually seeks answers to these questions, coverage questions, is at 12 midnight when she'd actually get to it. So she was very pleased that she was able to ask these questions, get this answer. And so that brings to the focus of today's panel. It's not AI in the abstract, it's AI in a sense of how do we empower clinicians and patients leveraging this technology. And yes, the Wizards lost the game if you're interested in that. So today we're going to introduce. I have a great panel, by the way. I'm so excited about this panel here, and I might not do justice. So I'm going to ask the panel to introduce yourself, but to mix it up just a little bit, as you're introducing yourself and a little bit about your role, I want you to give us a little something special that's not related to your role about you, so that we can kind of break the ice here. And I'm going to start with you, Andrea.
Hi, everyone. I'm Andrea Fletcher. I'm the Chief Digital Strategy Officer here at CMS, and I lead the digital service team. Dr. Oz was talking earlier about people working on the health tech ecosystem. A lot of those are people on our awesome digital service team. And yes, we are hiring. We are hiring lots and lots of software engineers and designers, user experience designers, user interaction designers, user researchers, and product managers. I came from the US Digital Service. I'm a product manager in a former life, and we write code. We build stuff around here. We're tinkerers and triers, and we pilot things. And that's our role here at CMS, and we're bringing in more people to kind of play around with new tools and new systems and build great things from CMS. Something fun about me, you can tell I'm a little stuffed up today because I have a 4-month-old daughter, Sophia. And so I have been through the ringer of the new parent tech, is what I will call it. So for those of you who don't have a newborn, there are lots and lots of new fancy apps and devices that you can buy for your child, and they all have great names, like, you know, the Owlet and the Nanit and the Bugaboo and whatever. And so I have been navigating that world. So I think as I was listening to people talk today, a lot of what I was thinking of, like, oh, my child will have everything tracked from birth, because, you know, you're obsessively looking at apps as a new parent. So that's my intro. I'll pass it over.
Okay, thank you. Hi, everybody. I'm Brian Hoberman. I'm a physician from Kaiser Permanente in Northern California, which has been my home base forever. I was actually born in Kaiser Permanente in Southern California, and that could be my fun fact, but I'll come back to my fun fact in a minute. Let's see. I started working in Kaiser Permanente in San Francisco before we had electronic medical records, and I had the privilege of leading the rollout of electronic medical records in our hospitals in Northern California. And then since then, I've been involved in our electronic medical records and now lead technology for the physicians across all of Kaiser Permanente. And my fun fact is I'm going to be a grandfather in June.
We can talk about that.
Yeah.
I've got recommendations.
Got tips. Yeah.
Hi, everybody. I'm Bakul Patel. Where should I begin? So it's like coming back home to this building. I used to work at FDA, and people know me most as an FDA digital health czar. I stood up the entire Center of Digital Health at FDA, and I worked with ONC so closely for the last 18 years. I was here, 14 years in FDA, and then 4 years at Google now. At Google, I've taken up the role for being a global regulatory strategy leader for all of Google products, which means everything that search does, everything that Map does, YouTube does. We guide them towards doing good for public health, and that's kind of how I see my role. Fun fact: today is my granddaughter's birthday, second birthday, happening actually right now. So right after this, I'm going to rush over there to party with her. So that's my fun fact. Just a little bit about sort of the excitement of this panel I share with you, Patrick, is it's really cool to see how things have changed even in the last 3 years that I've left the government. And I'm really excited to hear sort of the things that you guys are building on top of what's already available. So thank you.
Awesome. And I'm seeing a trend here, so maybe next year this time we're bringing the kids, we're bringing the new kids, and we'll have a party here. So. But let me start with you. And before we jump into the conversation, can you help us level set? How have you seen AI evolve in healthcare over the past 12 months?
It's going to be hard to say 12 months, but I'll just talk about the last few months. Things have been changing rapidly. So we partner with ASCO in terms of like giving information to the oncologist in a really easy, simple way. So person practicing in Nebraska has the same information either practicing in DMV or in California. I think that's the power I feel like AI has sort of brought to the table. The fact that you can just connect all these pieces through agents and bring it all together and surface it in the most meaningful way. I love that conversation that the other panel had about 60,000 pages, but you can throw that into a tool today and actually have it summarized or actually create even a podcast. And I have seen doctors do this, throw in a research journal paper into Notebook LM, which is a Google product and available for free, and turn it into a podcast and actually turn that entire conversation into a back and forth conversation with the tool. It's so amazing. And this all happened, by the way, in the last 6 months or so. So that's like one tangible thing. The second thing I would say is very practically, there is lots of efficiencies that go on in the hospital when there's a nurse handoff happening from shift to shift. Just the transcribing of some of that over to the next person taking on the shift. We are actually working and seeing a lot of those applications of nurse handoff kind of saving time, precious time in a nurse who's taking over the next shift. So this is a couple examples. On the consumer side, we are part of the pledge that Dr. Oz mentioned, and it's phenomenal to see finally, integrating a QR code in the Google Wallet or any other wallet can actually be a journey for a patient who can go to a doctor's office and go, here's the forms that you asked me to fill, and you just click this. And it's done once and done.
That maybe brings me to you, Andrea.
Sure.
From a CMS perspective, and what digital and interoperability foundations do you think need to be placed in AI tools to truly reduce the burden and empower our patients?
Yeah, so I have a team right now who's working a lot on Medicaid. And if you've ever helped somebody or have gone through the Medicaid sign-up process, it's different at every state and it is incredibly difficult. It requires paperwork being pulled from many different places. I think about it as, again, I'm a new mom, and if I had to fill out a Medicaid form right now, I have a kid that's screaming, that's hungry, and dinner's in the oven, and I just need to fill out that form, and it's asking me for pay stubs, right? And you need to get all your pay stubs, and people take a picture of them and send that in to the county person who then is processing it. And all of that it's a huge burden on people. And with HR 1 in particular, some of the new rules that are coming down, we have an opportunity to relieve that burden from the public. A lot of our focus as a team has been on building open source software with the states. So meaning we put all the code on GitHub, building things that people can reuse. So build it once and reuse many rather than having 56 different state and territory systems. How do we make it so we are able to work together and work within the different needs of the states, but to really build code that can do new things in new ways because it's more flexible. And we're gonna need that as we try to do things like use new AI tools to help that person who's trying to verify their income or verify that they're in school or that they work 3 jobs. They're an Uber driver and they work at Walmart and they work at Dollar General, and they need to pull all their data together in order to demonstrate that they do qualify for benefits, and make it faster and easier for them to do it, and make it faster and easier for the people at the state level to verify their information. So that way we can focus on the real problems, right? And I think that's where some of these tools can be really, really powerful in just serving beneficiaries and serving the citizens of our country in getting access to the services that they need, is really kind of focusing on building tools that are more like friendly for the states and the other constituents and groups that we work with. So our take on this has been to build in the open. We have the first open source program office in the federal government at CMS. And we do a lot of work on just publishing our code. I know that's kind of nerdy, but
Transparency.
it's radical transparency in government.
Yeah. Any comments from anyone else on that?
I love the transparency effort that you're mentioning. I mean, that was one of the holy grail that we wanted to. I mean, there's so much information that's like stuck in the knowledge of the government systems, and because government can see across, right? And I think just making that transparent for people is like so phenomenal. So thank you.
Thank you.
So let me turn to you, Brian. And I'm tempted to try to narrow down on how we actually reduce burden. And so my question to you is from a health system and from a clinician perspective, where do you see AI working today as a tool that's meaningful in reducing administrative burden and improving care?
Yeah, so thank you for that. When I participated in the EMR era, including meaningful use, which I guess was run out of this building, we went from a world that I started off in, which was paper records, which is the ultimate in information fragmentation, even with the benefit of fax machines that have been around for a long time. But I think you made the comment earlier about how much we love fax machines, and we certainly felt that way at the time. And we put all that information in a single medical record. And for those of you that know Kaiser Permanente, it's a very big integrated organization. And so we had these large integrated medical records that, of course, interacted enormously with other organizations, some which at that time were still on paper. And then as time passed, almost everybody had an electronic medical record. And we developed interoperability, which was also promoted by CMS, thank you. But it didn't solve the problem, because navigating all that information, even if it's digital, is very challenging. And so for me, when I think about burden reduction, I think about navigation. And when I think about AI, I think about finally have a tool that can process this monumental amount of information and lead to the best possible navigation. And some of the information is just, hey, summarize what's in the record. Some of it is just great convenience for our patients, like translate this. And by the way, I'm going to put in a shameless plug for, there are still a lot of regulations around translation that require humans in the loop. You guys might want to look at that, because that's a burden. And certainly human needs to be in the loop in many things, but do they need to be in the loop for translation? Just something to think about, like translating discharge instructions, that kind of thing. But what we end up with is, with all this information, with the ability to use the information to risk stratify the situation the patient finds themselves in, with the complexity of not only the delivery system that I work within, but the delivery systems we collaborate with. Are there ways of using computing to try to simplify that from the perspective of the patient who has a new complaint or has a complex illness like the ones you were talking about? Or the provider who works within an organization that has 350,000 employees, and no individual is going to know everything about all the resources of the organization or even what the very next step might be. So I think that the next level up, and it's a gigantic level up from the EMR era, which was in itself a huge level up from the paper era, is going to be using AI to help navigate within care delivery itself. And then when we talk about other things that are burdens, there are other burdens. Clinicians face pretty significant burdens around documentation requirements, which essentially in many cases is really a recapitulation of information that's already in the electronic medical record and well documented. And yet some of our rules require not only document every year, but document an in-person visit every year for chronic illnesses. So I love the idea of this access program and rethinking what some of those documentation requirements are. And then one last area that I think also was mentioned by a previous panelist, behavioral health, unbelievably important contributor to overall well-being is addressing behavioral health. The opportunities to rethink how we handle some aspects of behavioral health through the use of technology, that's a frontier right now where a lot of very exciting possibilities are, out there, and how we get there from here can greatly be contributed to by allowing more creativity and flexibility around the kind of A/B testing, experimentation, and science that would help us figure out, how best to use these kinds of technologies for the behavioral health challenges we face, particularly because I think behavioral health is one of those areas, like, say, coaching and chronic illness and other things, where being in constant touch with our patients through the kinds of technologies that would allow us to do that as an extension of what the docs and other caregivers want the patients to hear and reinforce is a real opportunity that we shouldn't let go.
That's excellent. At CMS and internally at CMS, our workforce have truly adopted the use of AI. We made significant investments in tools to help us accelerate many things we were talking about today on the ecosystem and the things we're trying to improve. To the tune is about 80% of our workforce are using some kind of AI every week. Based off my most recent kind of report, that's saving on average 5.5 hours a week on things they can now focus on, some of the critical work that we've been talking to today. But that's because I think it hasn't been to them as a burden. It's been more of an enabler. And one of the things I found very important was to bring in the total package. In other words, it's one thing just to buy tools. It's another thing to do enablement and training and education and make it fun for people to use. And I think that was some of the reasons why we are successful here. So my question is to you. And you have a unique background experience where you have federal experience as a civilian, you have industry experience, and then all in the healthcare or health sector. So how can industry, the health systems, and the government work together to speed adoption and trusted solutions at scale without additional burden?
I'm sitting here solutioning as you were talking, right? So I was like, I wonder we could take that, 5.5 hours of savings and just go to a hospital, pick a hospital in rural parts of America and say, use that same methodology that you use. Or you can go to another organization and say, like, can we import that same methodology? Can you imagine 5.5 hours saved equals what percentage if it was actually giving care to patients? Huge difference. So I think that's one thing. If I were to like brainstorm here and just share one idea, especially because my public health hat's back on now, is I would say like, let's incentivize. I love the idea of gold card. I mean, it's not new, but let's just say the idea of gold card, if it could start thinking about giving people the fastest you can give an appointment to a patient, that could be a measure that could sort of give the gold card a much more meaningful transaction for the patients actually getting access to a care provider, especially in the mental health and behavioral health aspect, because you can spend days, months, almost a year sometimes to get access to some behavioral therapist. So can we use those levers that CMS has at their disposal that can be then moved forward and said, this is incentive. If you behave in this proper way, there's an incentive for you to do this, and it sort of advances the burden sort of concepts that we were talking about.
Do you have something?
I do. I want to talk about this time-saving thing. So somebody earlier today mentioned ambient listening. How many of you have had the experience of being with a doc who's using ambient listening so far? So a lot of you. So a few years ago, we had a CEO transition, and our CEO, or the new CEO, looked at the workforce, which was coming off of COVID. And what was the phrase that we were hearing about doctors all over the country a couple of years ago? It was burnout, right? Heard it again and again and again. And so she turned to me and others I work with, and she said, how can we do something that would decrease burden right away? And she's very technology minded, and using AI was one of the things that she asked us to think about. And at that time, the ambient technologies were coming on scene. They were not yet integrated with the EMRs, but they were as standalone applications. They came on scene. And here's what I want to share with you guys. It was like, let me put it this way. Over the years of introducing new technologies and enhancements, the greatest praise we ever got was no complaints. Hardly anybody ever applauded what we did, even though they basically all agree that they can't live without it. When we put in ambient, everywhere we went, we were getting pats on the back. Like we finally did something that gave them time back. And so the interesting question then came from the finance-minded people, well, can you see more patients now that you get the time back? And the answer, fortunately, that we ultimately all agreed on was, no, let's use the time back to do better patient care, because nobody's going to just leave early. They are all committed to trying to do the right thing all the time, take that burden off their back and watch what happens. And in fact, what happened was, and I think you all know this, higher level of patient satisfaction, lower level of provider burnout, and generally higher quality care, because we didn't have an exhausted, burned out workforce. And this was something that was really enabled through the application of AI. Now, the second part of that story is, well, how do we know it was doing a good job? And that gets into the whole question of responsible AI, which we can probably touch on later.
Can I just add to this? So my son is actually a resident in St. Louis. He's doing pediatric neurology. And he talks to me all the time, being in tech, and we exchange all these conversations about ambient listening and other tools that are available. And he goes like, Dad, it's only meant for the people much higher than me, and I don't even get access to that. So there is a real problem. And I think the problem is about governance. I know you're going to talk about it later, but I think lessons learned from governance from one organization, like even CMS and your organization, can we make that standard? Because people are still struggling and trying to figure out on their own. Like this, St. Louis Hospital, University Hospital, is trying to figure out on its own what that looks like. Until the CIOs get comfortable, it's not going to reach people. So, but it's solved elsewhere. Let's just make that a playbook for people to sort of take it and run with it.
Like that. Anything from you?
I mean, whenever I think about like AI in a clinical setting or even AI at CMS, CMS is in a very difficult privacy situation, right? Like we have to be, we follow federal government rules on our cybersecurity, for example, right? And then we're also a HIPAA covered entity. So when we were launching tools at CMS to be able to use internally, like we are arguably in one of the most strict environments for being able to use those tools. And you have to build them, and I think credit to you, Patrick, and your team, you have to build them in a way where you are ensuring people that you have thought those things through, right? That you have privacy and trust are, you've demonstrated that you are following the rules and the guidelines and everything you've got, and that they can trust this tool that they're using, that it is safe and that it is secure. And I think that is a huge part of this, and making sure clinicians and patients are open to using these tools, is that you have kind of checked those boxes. And it's hard. It's like incredibly hard to do that, especially in the environment that we're in, but it's not impossible. And it's also not something that you can skip. Because if you skip those things, then you have a lot of problems, which is that people don't want to adopt your tools because they don't trust them, right? And you inherently need privacy and trust as you're building these systems in order to allow people to feel comfortable with the information that they are putting in there.
So I'm gonna stay with you on this, and,
Yeah.
and we talked about this throughout the day when it comes to our Medicare and Medicaid, how difficult that could be for beneficiaries, patients to navigate. So my question is, like, under your leadership, on the teams you're leading, what AI-enabled tools are the Digital Services Office looking at to help make patients make better perform in decisions and have a better experience overall?
Yeah, Alberto talked about it earlier, about the health tech ecosystem. I mean, there's like hundreds of apps that are available to patients. I think my team is kind of on the side of building things internally to CMS. One thing that we're building, and some of the key infrastructure pieces that I think are necessary to make all this work, is the National Provider Directory. Yay! Rural nerds love it. Which, it's kind of a shock to me that the U.S. hasn't had something like this in place for a while, but we just knowing where providers are, making sure that they have FHIR endpoints, making sure that we're able to access data accurately, is critical to all of this, to all of the information flowing. Like, we're building the highways, we're building the airports, whatever infrastructure analogy you want to use. That's kind of where my team is right now. It's also quite hard. There's a reason nobody has built this stuff before. So bear with us, those of you who are very excited, or come join us.
Come join us.
Yeah. If you have strong opinions on how a National Provider Directory should be built, please come on in. We'd love to have you. And that, I think, it's a challenge. It's a really big challenge because we have, not too many shots to get this right. And a lot of people and a lot of technology pieces are relying on CMS in particular to knock this one out of the park. So we need your collaboration on it. If our team is reaching out to you, we have technical working groups that we're working with. We have people sharing data with us now, because our goal is to be a source of truth for, provider information. And this country has never had that before, especially at a government level. So that's kind of the new thing, coming to you from CMS. But it's also all over our website right now.
Yep. Don't forget, as Alberto said earlier, go to our website and learn more if you haven't already. And Brian, I'm going to start with you, but in our world, in the healthcare space, in the health space, I think trust is a really big thing for us. The data that we manage, decisions that people are making based off the information they get is very important. I often feel or strongly feel that in the world of AI, our humans must be in the lead, not just in the loop. And what I mean by that is it's our humans, our people, who are setting the context of whatever we're doing in AI, setting the outcomes that we want, validating it. And not just checking it in the AI kind of running wild, especially in our space. So my question really, and I would love the feedback from all, perspectives from all, is a trust gap we're seeing with AI tools. Is it more about the technology itself, or about the tools or how they are implemented in our healthcare systems?
Yeah, so this question about how you build trust in AI is an unresolved question, right? I just, this past couple of days, have been using AI, and I've been using 2 different AIs side by side on tabs to plan a trip. And some really, really fun to do, but sometimes it gets it wildly wrong. And it's so, then you tell it you got it wrong, and it's like, oh, gee, thanks for pointing that out. Fine for planning a trip, maybe. When it comes to the kind of work that we do with patients, you know, making sure we do the right thing and do no harm is one of our core values. So how do we make sure that we can, as delivery system or as patients, because every single one of us is a patient and loves other patients, how do we ensure that we have this trust? And this gets to this question of what is responsible AI. When we put in ambient, what we did was we launched like 3 different teams who looked at it in 3 different ways, and we monitored every single transcript. We got feedback from the docs. We did this at the level of individual specialties because we didn't think that we could necessarily say if it works for, you know, family medicine, it's going to work for pediatric neurology. And we gave a massive amount of feedback to the vendor, and it evolved. The other thing that we did was we put in place ongoing monitoring so that if the vendor changes their model, and sometimes very tiny changes can lead to significant performance changes, we provide that feedback to the vendor right away. So that was one component of it. Another component of it was understanding the way our workforce feels about AI and understanding how our patients feel about AI. What we learned pretty quickly was most patients were pretty trusting about this ambient thing because, for one thing, their doc said they wanted to use it, but for another thing, because that principle of the human in the loop, which I don't think originated the phrase, but we could use the phrase augmented intelligence a lot. They knew that this was something that was going to help the doctor do what the doctor needed to do, and the doctor was literally with them while this was being done. So that kind of helped with the patients. Now, if we take it further with the patients, imagine a world where a delivery system, not Google itself or or a tech company, but the delivery system is offering a conversational AI triage. One of the questions that I, as a doc, get the most from my friends and neighbors is, such and such just happened to so-and-so, should I take them to the ER? I get that all the time, probably 5 times a year. Imagine that a Kaiser Permanente member goes into our AI, this doesn't exist today, where we know who they are because we, in an incredibly secure way, have access to their electronic records. So we know the difference between a healthy person and a person who's got chronic disease burden. We also know who just had surgery last week or whatever. And they say, I'm having knee pain. Now, in today's world, we handle that in a variety of ways. But in a world where the AI is curated by the delivery system, and it knows the delivery system and its capabilities, and it knows you, or if you're a proxy, it knows who the proxy is. Could we decrease some of the touches that today really are just bounce, extra steps for the patient and get them straight to where they need to be, definitively faster? We think the answer to that is yes. Do we think we can trust it? We think we can trust it if we are, as a delivery system, which is managed by physicians and other care delivery people, including pharmacists. There you are. Can we do that? Yeah, we think we can, and we actually think it's going to require a delivery system to do that more than a tech company, because the delivery system has access to information that the tech company isn't necessarily going to have, even if the patients have put all kinds of information about themselves into the tech company platform. So we think, just as people trust their doctors today, we want the AI to be an extension of who those doctors are in the future, as long as it's deeply curated by docs. And as I said, the delivery system trusts it by constantly scrutinizing it, making sure that it's doing what we think it's going to do, and that also requires a super tight connection between the informatics side of the delivery system, the operations side of the delivery system, and the platform side, where we really understand how the technology is evolving, because those small changes, as I said, can have a substantial impact on the thing.
I completely agree with you on this. I think there's a context for the patient who is asking something makes a lot of sense to be scaled with the right amount of supervision from the clinicians and the care providers. So I think completely makes sense. I think there is still this concept of, neighbors calling the doctor friend or doctor relative to ask for that initial step. So I feel like there is some level in between, and that's not because that's the most convenient thing to do. It's a trust. Going back to your trust question, like I trust Brian because I know him, and he's probably going to guide me in the right direction, even though he may not sort of solve all my problems, but he'll tell me to go navigate here. And that is the key question. The navigation of the healthcare system is complex. And because of that complexity, we all, including myself, go tend and ask the person we know the best of how do we what specialty should I talk about? What should I even present when I'm visiting somebody, a doctor? Like, what are those things? Because we all know doctors have only like 7.5 minutes to sort of get through to you. So I think that's the part of this. Part two of this trust question is about familiarity of the technology. And I'm not speaking just as a technologist. Because if you're not kicking the tires, then you don't know. The experiment that you're doing for planning a trip, that is kicking the tires in my mind. And as people start kicking tires more, you see a lot more sort of trust in the technology. There are going to be people naturally going to be not trustful of the technology. There are people who will be like all leaning in, fully knowing with that commercial I remember, like because it's written somewhere, it's true. Maybe maybe people work, but I feel like exposing healthcare systems. I'm not talking about patients because that's a very large problem, but at least in the care settings, if people were allowed to touch, kick the tires, try things on their own little safe domains that they feel they're safe before actually exposing to patients, it might actually start building more trust, and I feel like that would be the way we need to build.
Very good. Anything from you, Andrea?
I think about my experience outside of the healthcare system right now. Like when I shop for something online, the internet knows what I like, right? Like it knows what size I am, what stores I shop at. It knows that I have a child, how old she is. It serves me up content based on that. Some of the content is terrible. Some of the content is not what I want, and it's misinformation. And some of the content is actually pretty good. And it's going to be interesting to see how healthcare adopts that same environment, right? How do we serve people information in short videos, and because they're out there, they're looking at stuff, they're shopping online to buy things, and things are getting recommended for them to use that are health products. And the actual, ecospace of clinicians and providers, it's gonna start to come together here soon. And I think that's gonna be a really interesting space to watch. It's happening. I see it every day. I'm sure you all see it every day. And people send you videos or ask you questions, or things are recommended to people. So I don't know. That's just one of my thoughts on all of this. I guess as where is this going, and how are we going to integrate that real world space that people are interacting with these tools and algorithms every day. And as that runs into the actual clinical setting, how can we leverage that? Because it's going to happen whether or not we like it.
Your shopping example makes me think about something that we're experimenting with right now, which is this idea of using digital twins.
Yeah.
We have a small pilot going on right now where we've taken folks who have type 2 diabetes and metabolic syndrome, and we've given them a digital twin. It's informed by a lot of blood work data. It's informed by a CGM, and where they do meal logging. And the statistics from the overall population are not back yet, but anecdotally, I want to share with you guys that one of the people that we put in there happens to be a colleague of mine who struggled for years with metabolic syndrome. And this person recently wrote to me that their health has never been under better control, and that this person had tried everything. And so there's something about this relationship between the information in the app and behavior that has changed in a way that's allowed this person to not experience some of the challenges that they've experienced before. And I think that's just remarkable. And it gets to what can happen, if these tools really know you and are really tuned to the science. And it's the behavioral science, and it's in this case, the metabolic science. So I'm very optimistic that, again, if curated by physicians and other care delivery professionals, these things can be remarkably effective. And by the way, the end point of this is to see if behavior change can take people off drugs, some of which are expensive. And the preliminary, and it's quite preliminary, but the preliminary looks like, yeah, it can. And that it's in and of itself is pretty remarkable. In the future, are we going to be thinking of some of these technologies as a drug?
But I'm gonna come to you on this one. A little context is I can certainly measure when it comes to AI in my space how many people are using it, how often they're using it, and we can do surveys. We can save the time. What's very difficult to measure, if it's actually making the impact on reducing some kind of burden. That is so hard to measure. I mean, so in terms of administrative burden, which is very difficult, already difficult to measure. How do you know if you're having success reducing it, and when it comes in the lens of patients and providers?
For me?
We'll start with you.
I think so the fact that we can talk about administrative burden, I think for me, it's the basis is administration. By default, it seems like in the non-value added time sort of bucket of the lean products, or like a lean way of thinking. So if there's too many transactions going on for no reason, and there's lots of weight going on in that, if people are finding a hard time to find an appointment, to me I would categorize that as administrative burden. If people are going to spend a lot of time trying to find the right code so they can bill at the right level of service, to me that's an administrative burden. So if we can make all of that easy, in my mind, I think that if you can start measuring at that granular level of like, okay, service is provided, which we all know what time the service is provided. We all know when the billing happens, when the buttons are clicked. Can we start reducing those times? Can we make it so integrated so it's like ambient listening? I think that to me would be phenomenal if you start thinking about from just even that one use case of taking care, giving care, sending a code so it can be billed. I mean, all that stuff can be totally integrated, I feel. To me, that's the measure. We got to get down to that next level, down in the details. Otherwise, what's going to happen is we'll keep talking about administrative burden in this large bucket of things and not really know where the issue, because administration needs to happen, but does it need to happen in this way? I think that's the question.
Yeah, certainly. Andrea?
Yeah, I mean, for a group of technologists, my team spends a lot of time talking to people. We actually like judge ourselves by like how many beneficiaries have we talked to this month and how many hours have we spent just talking to real people who are using the tools that we're building, because it tells you a lot of problems about your technology when you sit down to next to somebody and painfully watch them try to navigate something you're building that you got it wrong, right? So it's kind of anti-tech, but it's the right way to build technology, is to build with users and to talk to users frequently. We also really love call centers, call center data. I personally, like anytime now that I call customer service and I get an AI chatbot, I am doing everything. I'm like pounding 0, right? No, I do not want to talk to you. I want to talk to, how do I get to human? How do I get to human, right? As fast as I can. And I think that's going to actually be a really important part of all of this moving forward, is when somebody is having a challenge, and we see this with 1-800 Medicare all the time, like the actual interaction with the person is going to tell us a lot about where they're struggling, and where they're having challenges and what they need help in. You know this and I know this. Logging in is always our number one issue, right? People don't remember their logins. They don't.
Can AI fix that? No.
Can AI fix a login? Because that is my number one issue almost all the time, and same with you, right? People need to log into a system and they forget their password. And that's the kind of stuff where, like, I think we're just gonna have to focus on having really excellent customer experience, and really, really excellent user experience, because the technology is moving incredibly fast and can do really fantastic things. But when the technology breaks, it's also pretty, epic. And so we're gonna need to be there to understand where and how it breaks to fix it quickly. And we're gonna need to be able to talk to people. And we're gonna need to be able to have a touch point with them that's, able to actually get to the root of the problem.
Very good. So we're going to go do a last fire round here, and perhaps in maybe 2 sentences or less. And I'm going to start with you, and we go down the row here. What are you most excited about in the next 12 months?
Oh, in the next 12 months. I think how people interact with government websites is going to change over the next, I think it's been changing for the last 2 years in general, but the tools that are going to become available on government websites, the chatbots, the new types of logging in, the way that you interact with something like Medicare.gov, which millions of people interact with every day, or healthcare.gov, right? These are websites that we build at CMS. I think it's going to change a lot, and I think it's going to be interesting to see what new features are rolled out, and that's going to be an exciting shift for everyone, as government websites, maybe we're a little bit cooler. I don't know. Tad bit. We try.
How about you, Brian?
So I'll do 2 sentences. Sentence 1 is real world. We're deploying a brand new state-of-the-art PACS system, and integrated in the PACS system is the ability to use imaging AI in ways that are unprecedented. That's going to be coming online in the next 12 months. And in the future, this experimentation of the kinds of things I've been talking about, of how AI can enhance patient and provider and delivery system navigation, we're going to be doing a lot of that in the next 12 months as we try to R&D this, and I'm excited about that too.
Awesome.
Where should I begin? I'd just say that I get the second row seat at where technology is going, not the first row because the engineers actually are building it. And I sit like right behind them to understand where things are going. Technology is going at breakneck speed. Things that we are complaining about today about patient intake and hitting pound zero to sort of get to a human operator. I think I'm incredibly excited about some of these conversational tools are going to get so natural that we will probably not want a human in that case. So I feel like that flip is going to happen in the next 12 months. I think somewhere between now and next 12 months, you'll see that sort of slow rise in sort of the knowledge and the empathy and the patience to understand what your real problem is going to come through this technology. I totally believe this. And it's going to, I feel like it'll probably make a dent into all the administrative burden that we've been talking about. I totally believe that.
Yeah, good. Well, I tell you, I'm personally looking forward to the next 12 months to hear more stories like that rural provider out of Ohio. Her testimony when she was very pleased that maybe something small to us was a big impact to her, and I think we have an opportunity over the next 12 months to have more stories about that, and we want to hear from them as we make these improvements across our various areas. Thank you again, panelists, for your time here and your expertise, and thank you everyone in the audience. If you give them a round of applause.
Thank you.
It's been a fantastic discussion. Okay, we are going to clear the stage, and we're going to turn over to Chris Klump. I have the pleasure of working with Chris Klump at CMS, and I just very appreciative of his bold his leadership, some of the things he is driving, truly making a difference already in just a year. And he also has a new hat joining us as the HHS Chief Counselor for all of operations. So he's going to deliver a closing keynote, and you don't want to miss that. So we're going to clear the stage, and we're going to pass it over to Chris. Thank you.